So you have two large heart models and one small heart model. Underneath here, this is the right atrium, This area here is the right auricle. Underneath here is the right ventricle. This is the left atrium, the left auricle, and the left ventricle here. Deoxygenated blood are going to enter the right atrium, which is here. From the lower parts of the body, it's going to enter there through the inferior vena cava. From the upper portions of the body, it enters through the superior vena cava. The superior vena cava is formed by the right and left brachiocephalic veins. Once blood gets into the right atrium, it can then travel to the right ventricle through the tricuspid valve. The tricuspid valve also has these strings, which are the chordae tendineae. The chordae tendineae are attached to the papillary muscles here. When blood enters the right ventricle, the heart contracts, pushing blood up through the pulmonary semilunar valve. The pulmonary semilunar valve then opens, allowing blood to enter the pulmonary trunk. The pulmonary trunk is going to split off into the right and left pulmonary arteries. From there, blood becomes oxygenated and then needs to return to the heart. It's going to return to the heart at the left atrium. Blood returns to the heart at the left atrium through the left pulmonary veins and right pulmonary veins. Once blood is here in the left ventricle, it'll then travel through the mitral valve or bicuspid valve. These are the chordae tendineae of the mitral valve. Those are connected to the papillary muscles down here. From here, blood will travel through the aortic semilunar valve, which is hidden here. From there, blood is going to enter into the ascending aorta, which is here. The first branches of the ascending aorta are the right and left coronary arteries. This is the right coronary artery, and just right here is the left coronary artery. The left coronary artery is going to split, forming the anterior interventricular artery and the circumflex artery. The circumflex artery continues going around towards the posterior portion of the heart, and here in blue we have the coronary sinus. The coronary sinus. This portion of the aorta is the ascending aorta. This portion is the aortic arch. This is the aortic arch. This first branch here is the brachiocephalic trunk. Okay, the brachiocephalic trunk. This is the left common carotid artery, and the third branch is going to be the left subclavian artery. After the aortic arch, the aorta will continue to descend as the descending aorta, more specifically this portion which goes through the thoracic cavity is called the thoracic aorta. This is actually the esophagus here, and this is part of the trachea. And you can see more of the trachea and the cartilaginous rings here. The trachea bifurcates or splits, forming the right and left primary bronchi. We actually have a structure here that as an adult has no function. This is actually a remnant from fetal circulation. So in the fetus, we have a bridge that goes directly from the pulmonary trunk to the aorta. So in the fetus, the entire pulmonary circuit is bypassed.